everyone. My name is Jose Leon, Chief Medical Officer for the National Center for Health in Public Housing. Thank you for attending this National Center for Health in Public Housing podcast, part of the podcast series from the National Center for Health in Public Housing. The National Center for Health in Public Housing is a project of North American management and is totally funded by the Health Resources and Services Administration, HRSA. The information that we are going to provide is information that is not the official position of HRSA, but these are comments from those who are participating on this call. I am very pleased to have two staff members from La Maestra, but before we get started and we have some questions and a brief conversation with both members from La Maestra, staff members from La Maestra. As an introduction, public housing primary care grantees offer services to women who are or who live in public housing, as well as those special and vulnerable populations in the community. The public housing residents in general suffer from chronic medical conditions, and health centers are the opportunity that they have to access preventive services and healthcare services, specifically services like mammograms and cervical cancer screening, domestic violence, intimate partner violence, and all the services, healthcare services for women that they need to receive every year, including immunizations, glucose testing, and other services provided by health centers across the nation, and specifically those offering services to public housing residents. So it's such a great honor to have two great members from La Maestra, and I will let them to introduce themselves.
Oh, this is Cynthia Kaiser. Good morning. I am the Chief Community Development Programs Officer for La Maestra Community Health Centers. I oversee different departments that interact with our community, which is our Community Health Access Department, our Homeless Outreach, and our Reentry Specialists. These individuals work closely with our community as we are focused not only with our underserved population, but to include our high-risk youth individuals that are in transition, whether they are in juvenile or if they're awarded to the state due to circumstances in their household or perhaps in their actions. We also connect with community schools, which are basically the last stop from high school, where they're not able to attend traditional schooling, but they have now a condensed version and other counselors that case manage them. So again, this youth that we're talking about can range between the ages of 11 years of age up to now 22 that may be in their home, homeless, or in foster care. As I mentioned, we do work closely also with law enforcement. So youth at times, our family members are incarcerated. So we do connect with our county jails and detentions, as well as the state California Department of Rehabilitation and Corrections as well. And again, to promote the services and connect them to access to services. Lastly, one of the other areas that I oversee in developing new programs would be our mobile unit. We do have basically a clinic on wheels, which goes into the community to eliminate other types of barriers and increase access to medical services, as well as health education and support services.
Thank you, Cynthia.
And now, okay, go ahead.
I'm sorry. And we also have on the line Noemi Romo. Hi, Noemi.
Good morning. My name is Noemi Romo, and I'm the supervisor of our health education department at La Maestra. We oversee or we provide diabetes education hypertension education to our patients, basic nutrition education, but we also provide family planning education where we can discuss birth control methods with our patients, as long as the importance of interconception care. We assist patients in planning their future, their reproductive future. And when they are in the moment of prenatal care, we also coordinate their care. So we see a patient throughout their pregnancy. We ensure that they are getting all the services that they need, all the labs that they need. We discuss interconception care at that moment as well. We do focus on prenatal care, but we also help to prepare them for their deliveries. We help to prepare them for their care of the baby as well. We do this through individual sessions. Right now, during this time, we are doing telehealth. So we're doing it over the phone, which we've seen is very helpful for patients, especially during this time. They need that reassurance that everything will be fine, and we're helping them there. We normally do face-to-face visits. We provide group sessions as well, but right now we are doing the telehealth, and it is very effective for our patients. They are well informed of their care. They're well informed of what is happening, and they are open to coming to their prenatal care here at the clinic with their providers.
Thank you so much for that information. And if you are listening to this activity, we are in the midst of the COVID-19 pandemic, and we can say that we have activities that are pre-COVID-19, and probably we're going to have activities post-COVID-19. So Noemi has basically mentioned the use of telemedicine because of the pandemic and how the pandemic is affecting health centers across the nation. So I have some few questions regarding the services provided by La Maestra to women in San Diego, California. Specifically, some preventive services that Cynthia mentioned early, but at the same time, some of the healthcare services provided by La Maestra. So, Cynthia, if you could tell us a little bit more about the at-risk youth program that you have, and then you mentioned in the very beginning.
Yeah, so basically our youth at risk are impacted in a variety of ways. Some of them are awarded to the state, which means a different workflow and process has to happen for these individuals who need the medical services. The counselors work closely with our teams. We do have an engagement manager, and she connects with the counselor on the daily, especially right now with COVID-19, has taken the relationship and partnership closer as the access to food, sustainability, and them being in crisis. But without the critical emergency that we're in, on a typical normal day, it's basically still working with individuals who are still needing medical services, dental services, vision and hearing, because their school is unique. It's not a traditional school, and they do support them with clothing and a place to shower, for the mere fact that, like I said, some of them are homeless. They may be in foster homes. Sometimes they run away. So our team is able to connect not only with the counselors, but also to foster a connection with the individual so that there is this trust there that they can come in now, access services. I'm sorry, excuse me for 1 second, that they may need to access services and they may be in crisis. We've had connected with individuals who are homeless on the street and needing, again, those immediate resources, being trauma informed, having people on our team that are culturally diverse, meaning that they may have experienced homelessness or something in the past. So now there is this connection, the rapport with the individual that we're working with. Again, that gives them the sense of, the footsteps I'm in, and there is that bonding opportunity there. And we have had success stories where individuals continue to go to school, being able to overcome some of the challenges, being able to trust and go into our clinic and be able to go through our circle of care services and navigate them not only to our health education department, being able to get medical services, and lead them into also our medication-assisted treatment, which now they are wanting sobriety. But as you can imagine, an individual who is a minor who has already been impacted by so many challenges, now understanding that their quality of life can improve, and having a person being with them, being one of those reentry specialists or a homeless outreach specialists, to navigate them through. They're not alone in this crisis that they're experiencing. And so we have had success stories. Individuals continue to go to school. They now decide that I don't want to be homeless, or I'm going to stay with my program, and I am going to now enter a program that I can go into sobriety. And that is success for us. It's always success. And I tell our clients, our people that come through our doors, that the success was just making it to the office, being able to give us an opportunity to connect with them, building that rapport with them, and outlining a plan with them. We do the interview with them. What do they want? And the plan is integrated with their goals. And we just basically eliminate the barriers and get them to that next step so that they can complete their school, so that they can be in a home that is safe, they can receive the medical services that they need. And at that point, when we're able to walk them over to our pantry and they get food, they're able to go into our clinic. We have our Hope Clinic, which is a side door to access to health. It's a more intimate, beautiful, small clinic where they don't have to be worried that maybe the neighbor they may have known in the past will see them. In a large building, now we have a small, more intimate clinic that they can enter, access health, access dental, and then remain connected with their primary care provider that's there. So it's been really amazing to work with these individuals who are underserved population and are high risk, and they maintain the relationship with us. And the positive outcome from that is they become the brochure, they become the success story that navigates other young youth individuals to us. And they say, hey, my friend said this and you can help me out. And we said, sure, come on in. We provide them hygiene kits. We become part of the positive reinforcement they need. We hear them, we listen to what they want, and we tailor out the plan that will get them in a positive environment as much as possible. Unfortunately, sometimes there are some relapses, but we don't judge. We tell them, we have hope for you. We are still here for you, and we check with them. We case manage. Our community health workers and our reentry team works closely in case managing these individuals. There's not a time limit. It's not after 6 months. We disconnect with you. We continue to call because we don't know the clock. Everyone has a different clock that says, I'm ready. I'm ready now. And our team says, we're ready here. So it's been a really amazing opportunity to work with a population that at sometimes are not seen. And with this crisis, everyone is being seen as we've seen them in the past, and we continue to advocate for them.
Thank you, Cynthia, for that great information. And now I would like to ask a question to Noemi, and specifically regarding the Women's Health Program. Public housing residents, well, first, there are around 59% of those living in public housing are women, and they expect to experience some chronic medical conditions and some issues like domestic violence and intimate partner violence and substance use disorders. So when a female patient, go to the health center, basically she's looking for different kind of services. Either she's looking for vaccines or for a behavioral health intervention, or because she has a chronic medical condition, or because she needs some screening. What are some of the challenges that you see in the population that you serve, and what services you provide to address those challenges?
Well, we ideally want to see all of our patients, female or male. And what will happen is when they come into the clinic and they see a provider, whoever they see first, there's always that ability to refer a patient to our department, whether it just be a nutrition appointment or, again, diabetic, hypertensive education, or if they are pregnant or do not want to become pregnant. So there's always a curriculum for our patients. The first thing that we do before we begin to inform patients about anything is an assessment where we ask a lot of questions to kind of see what are their needs, to see how we can help them. The good thing about La Maestra is that we have a lot of services in-house. So if a patient says she has substance abuse issues, we can refer her to our, the department that can assist her. If she's having mental health issues, we can refer her to another department that can assist her. So with that access to all the other departments that can assist a patient, I feel that we're able to answer or ask those questions more freely. So we do an assessment where we discuss transportation issues, where we ask basic health questions, where we ask about nutrition, and we definitely discuss inter-partner violence. We ask those questions that maybe if the resources weren't available, we would be maybe a little reluctant to ask. So I think the most important thing is to know the resources that are out there, whether it be in your clinic or whether it be in the community. Knowing where to send a patient is the most important thing. It's that tool that kind of empowers you to ask those questions because you have a response, you have a place to direct the patient. So there is a variety of issues or barriers for our patients. Being a community health center and located in the community is a very beneficial aspect. Patients do not have to get in a car, drive through transportation. They could just walk to our various sites. So I think that's a big benefit for our patients. There is definitely inter-partner violence, and it could be, maybe child care could be a barrier as well, but we try to assist patients in those needs as well. So I think the most important thing is that assessment that we do with all of our patients, and we attempt to do reassessments as well. As long as the patient continues to see us, we will reassess from time to time to ensure that nothing has changed or that we address those needs that are most important to that patient at that moment.
Thank you. Thank you, Noemi, for that information. And Cynthia, the other question I have for you is in regards to the youth at risk program that you have in place. What is the role of the CHWs or the health educators, and how you coordinate the activities between the CHWs or the health educators and the clinicians?
Yeah, so what happens is the community health worker, they're the liaison between the patient, client, to the clinic. So they advocate for them, they are their lifeline, and they connect them. And as Noemi mentioned, we all bear that responsibility in making these referrals, whether they're social support services or they're medical services. So it's basically getting them to the clinic, ensuring that they're able to access an appointment, and through our circle of care, which are all the petals of all the services that we provide, is to make sure that we eliminate the barriers to get them to those appointments. You need transportation, we'll coordinate transportation. You need food, we'll help you get food. You need an appointment, we'll help you get an appointment. So the role of the community health worker is basically to help that individual get the services. And the case management is to make sure that if there's something that they need from us, that we get it to them immediately. They're not a doctor, they're not a nurse, they facilitate the information, they need to see their doctor again, they need to follow up, so then, the navigator will then help them get to those appointments and get to the doctor so that they can get the medical information, or the nurse so that they can facilitate those medical information to them.
Thank you. And just for additional information to the audience, you briefly referred to CHWs as the cultural liaisons, and the reason is that in Santiago, if I'm not mistaken, or at least La Maestra provides services to people from almost all over the world. Is that correct?
That is correct. We have over 29 languages, and we do have cultural liaisons because the impact of a critical incident does not deviate or differentiate from race, religion, or where you came from part of the world. So to our benefit, we have cultural liaisons that speak the language, we appreciate their culture, and helps communicate that information from the patient to the doctor to the support services, so that in a very well-respected, culturally sensitive manner, we can help out our community and our individuals.
Thank you. This question is for Noemi. La Maestra has an excellent cervical cancer screening and breast cancer screening program in place. Specifically, you use the mobile unit to provide those services, and it's my understanding that you go to the community and provide the services, and you've been even working with other community health centers to provide those services in areas where probably are not part of the La Maestra community, but you go to other counties that are close to Santiago. So how does it work, and what is your experience with the program?
Well, I know Cynthia is more in charge of our mobile department, but I do know we go out to the community to various locations, whether it be in our close proximity or farther away, because we understand that patients or people everywhere need assistance. And again, we're trying to limit those barriers, that distance barrier. So we do go out to the community. We provide these cervical screenings and mammograms, and we have it on our mobile unit, which is very helpful because a patient or a person doesn't have to go anywhere. We go to them. And once we've touched base with them, we have a huge team working to follow up with the patient. There are staff members that track patients to make sure that they are getting that regular annual mammogram, getting that cervical cancer screening when necessary. We have navigators that help to follow up with patients depending on the results that they've received, helping them to kind of work through the system, find those supportive systems, programs that are closer to home than maybe we are. We understand that, we can't maybe reach all of our patients, so we try to connect them to the closest community health center. It's amazing, but here in San Diego and with all the community health centers that are available, we really do work together. We're not trying to fight to grab a patient. We understand that there are tons of patients, tons of people out there that need assistance, and we're just here to help them and try to get them to where they need to be. So we love to kind of work together and share and try to get everybody where they need to be to get the care that they need.
Great, thank you. And there is a program, and this question is for either you, Cynthia, or Noemi. Specifically, La Maestra is in Santiago and is very close to the U.S.-Mexico border, and there are cases of human trafficking in that area. And even though human trafficking cannot affect anyone, regardless of gender, women are more likely to suffer from human trafficking. Can you tell us a little bit about the human trafficking program and all the activities that you do to protect and provide services to those who are victims of human trafficking? Cynthia or Juan?
Yes, can you give me 1 second, please? I'll be right back on.
Of course. So we were talking about the human trafficking program, and if you could provide, give us an overview, I mean, for other health centers to understand the program and the activities that you're doing to address this issue.
Yeah, so we're very fortunate that at the same time it's unfortunate that human trafficking is happening here in the United States. And here where we're located so closely to the border, we always say, well, the human trafficking is happening from the border to the U.S. Unfortunately, at times it happens here in the U.S. where individuals are being the human trafficking is happening to our youth. And we've experienced this with our individuals who are homeless, and they feel that they have nowhere to go and that they have to stay in a toxic relationship and have to endure some of the unfortunate abuse that comes with being a young lady, a young man who is impacted with having no place to go, no friends that could help them, and they sustain abuse. And abuse comes in various fashions when it becomes human trafficking. It basically means is that they're being used so that they can pay off sometimes a debt that is not even theirs. And we've been involved with individuals who have required our immediate assistance, our strong advocacy, and connected to our human trafficking department, which specializes and works closely with our district attorney to file cases, to have investigations and protect them and provide them immediate housing and support services. And again, they get navigated through our circle of care services so that they can get the medical services, the behavioral health services, and the strong hug of La Maestra to protect them and help them as they're going to be healing through this process. And as I said earlier, it's really important that when we connect with an individual that's in crisis or not in crisis, is that they understand that we're here for them and we're here to serve them in whatever capacity that they need. And that relationship, that bond that we formulate, gives the other person that they may be speaking to that, go to La Maestra. I know that they will help you. This is what happened to me. And then they come. And as it relates to human trafficking, we get more teenagers that come in. We have young men that come in. And unfortunately, they were victimized. Their clothes were stolen. They were hiding underneath a stairwell. We had to send staff over to provide him clothing and then navigate him into the clinic. And that's just one incident of many unfortunate situations that happen that we get involved and we go to protect a person who is a U.S. citizen that has been victimized in the U.S. So we've also had situations where individuals were brought from other parts of the world to receive services for the services that they're going to be getting. And so what happens in those cases, you have a person who's foreign and not knowing their rights, having to trust somebody that they don't know. And we've had opportunity to help those individuals also be protected and navigated correctly once they walk into the clinic. They see a health fair, looks fun, it's exciting, and then we start talking, asking questions, and then we take them and we help them. So sometimes our health fairs provide several opportunities, not only to promote the health and well-being, we're here to celebrate your health, but it also gives an opportunity for them to see what other services, and we're able to react right there and then.
Excellent. Thank you for that information. And it is unbelievable to still have human trafficking cases, and this is the 21st century, and still having that issue, and that's a public health concern. So I am quite sure that health centers across the nation will be more interested in learning about the program. And I have another question for Noemi. We are in the midst of this pandemic, and you mentioned earlier about that you are offering some of these preventive services or healthcare services through telemedicine. So what is your experience with telemedicine? That's one question. And the second question is, recently, one of the issues that some of the populations that are being served by health centers is the fact that some patients are afraid of getting services due to the public charge issue. So what is your experience with both?
Well, I think it's an interesting time that we're in right now, where we are constantly readjusting, learning, modifying our services that we provide to our patients. Luckily, one of the services that we're able to provide, or a means of providing those services, is through telehealth, where a patient could be in their home and they can pick up their phone and we can have a session, either a health education session. And I know our OBGYN department is also providing some visits with their providers through telehealth. I feel that this has been a big benefit, because some of those patients that just do not want to leave their house, whether it be because of the charge that's coming or is happening, or because of the fear of, not wanting to come into a clinic and be exposed, they are able to, again, have these visits and have this security over the phone. So I see that this has been very beneficial for our patients. And, it's a lot easier to have a phone visit than to have to walk into a clinic. So we're able to call our patients on a weekly basis and just touch base. A lot of these patients really just want to hear from someone in the outside world, because we're, safely staying at home and our patients don't leave. They are very excited when they get the phone call and they're able to talk to someone outside of their home. So I feel that this has been very beneficial for our patients.
Thank you, Noemi, for
Doctor,
that. Yes.
Could I echo a little bit more on what Noemi shared?
Sure.
So the telehealth, whether it's by a phone call or through another system, which is similar to FaceTime, where you can have your cell phone and you're looking right at your doctor. The cultural liaisons are also being utilized, so that there is no fear that they still don't, they don't speak the English traditional language, but where they're speaking their language. A cultural liaison is also being utilized as well. And there is an increase of appointments being kept because of the barrier of transportation. Everybody is following the ordinance of the staying in. And as a result, there's other mechanisms that came into play with delivering medications, still maintaining with their doctor. And so it's been a very, very positive outcome. We still have our dental office is doing telehealth. So they're able to get that emergency visit because they're having pain, experience pain or discomfort. So they're able to speak to a dentist through telehealth to then determine if they need to come in as best as they can. Seeing each other on the phone, it's been very positive. Again, to access services and our support services as well, because as like Noemi mentioned, even more so, the levels of anxiety and unknown sparks up different types of questions and different types of visits. And being able to have those appointments kept and our providers readily available has been very positive. I wanted to share across the board our medical providers, to include our dental. Unfortunately, right now, what we're not using is the optometry, but we still have our chiropractor because, of course, everybody is tense and there's pressure. So we have those services that have to continue actually face-to-face visits. So I just wanted to share a little bit with you.
Thank you so much for that. And that reminds me, I have a follow-up question. This is regarding health literacy and sometimes technology literacy, I guess. Some patients may have issues using telemedicine or accessing internet. What is your experience with patients who probably are not computer savvy? Sometimes you have patients who are having issues, and how do you address that issue?
So I think, again, we try to work with the patient, determine their abilities, their computer literacy, and again, that telephone call. Mm-hmm. Right now, everybody is able to pick up the phone. Luckily, a lot of our patients have phones, even if they are homeless or they don't have a lot of services, or Medi-Cal provides cell phones to our patients. So most patients do have a phone, and sometimes it's just that phone visit that you need to determine if they actually need to come in because they're having, computer literacy issues, or they don't understand, very well over the phone. We can ask those basic questions to see if a patient needs to actually be brought into the clinic and have a face-to-face visit. We try to avoid, if we can do the session, the appointment over the phone. That's our first attempt, but if they can't, then we still have those services available face-to-face for the patient.
Thank you.
And Doctor, I have a little bit of something to share. Is we're also utilizing our social media to do different additional awareness campaigns. Because we do have other grants, and how we can educate, because that is sometimes the way that families and everybody are communicating, whether it's through Instagram, whether it's through Facebook. So we're doing cooking demos, we're doing health education information, so that we are getting it out there to the public and promoting the services. And then the how-to, what does telehealth look like? And putting very simple instructions so that they can log in. So what does that mean? What is telehealth? They know that they can use their phone. As Noemi said, a lot of people have cell phones. So they're able to do FaceTime and Zoom. So now, by us being on social media to promote more services, when it's time to have that appointment, they can now connect the dots and know what that looks like.
Thank you. Any experience using the patients portal during the COVID-19 pandemic? I mean, do you have more interaction with patients through the portal?
So that's a good question. We can definitely ask Sonia. Her team oversees the patient portal and the volume that comes in to schedule appointments. I know that there's been some changes made for patients to have the ability to send a request for their medical records, wants an appointment. And we recently launched our phone app that allows them also to schedule an appointment and see upcoming events as well. But we can get some more statistics from Sonia.
Thank you so much. Well, I would like to thank Noemi and Cynthia for this conversation. It's great to hear from them the activities and the services provided by La Maestra, not just during the COVID-19 pandemic, but what they have done and what they will keep doing to address the healthcare needs of patients in San Diego, California. So it's always such a great pleasure to have this conversation and learn from those who are in the field, how they are addressing the healthcare needs of those of those living in public housing and those who are at higher risk of chronic medical conditions. So thank you so much, Noemi, and thank you so much, Cynthia, for this wonderful information. Thank you.
Thank you very much.